is C. People who are 50 and over who have a hip fracture have a 1 in 3 chance of dying within the year. That is a really scary statistic. So as you can see, hip fractures are a very big deal. In fact, older adults have a 5 in 8 chance. That's a 62.5% chance of dying within 3 months of suffering a hip fracture. Now, why does this happen? Well, for one, typically surgery is going to be needed to address the hip fracture. So there's first the trauma of the fracture, and there's the pain of the fracture. Then there's the anesthesia for the surgery. There's the surgery itself. And all of this can be a particularly large stress for folks with pre-existing conditions. Indeed, having a history of heart disease, stroke, or pneumonia doubles your risk of death after a hip fracture. There's also going to be the risk of thrombosis and pulmonary embolism that arise from a lack of movement after the hip fracture, and also all of the risks that are related to